My name is Pengyi Shi. I'm associate professor in the supply chain and operations management group in the Daniels School of Business, Purdue University. The nursing shortage is going to remain a big issue for the next decade for multiple reasons. First, on the demand side, many baby boomers are going to retire and they have increasing medical needs. This need is not gonna disappear, so the demand side is gonna keep on increasing. On the other hand, on the supply side, the nursing school enrollment has been at a relatively stable rate, so we're not gonna see a huge expansion on the amount of nurse supply in a short frame. What makes things worse is during the pandemic, due to the high workload and burnout, many nurses choose to quit a job. So this has made things even worse. So this ongoing nursing shortage has a big impact on both patient outcome and nurse well-being as well. So let me start from the patient outcome. So there's a term called patient-to-nurse ratio in hospital staffing. So the typical desired patient-nurse ratio is 1 nurse for 4 to 5 patients in the typical units. However, if this ratio goes beyond, say, 1 versus 6 or 1 versus 7, then the nurse may start to get burnout, fatigue, and this is when the quality of care decreases. And also, nurses are human beings; they tend to make more mistakes when they're taking care of too many patients, and this may also translate into longer lengths of stay in the hospital, higher readmission, and also more harm events. On the nursing side, when nurses keep on working under such a high pressure, their own well-being are going to be affected. So this is a reason for the nurse burnout and high turnover we're seeing from the pandemic. So I think there are several important lessons we learned from this pandemic. There is a sort of a big resource shortage, not just in nursing, but across different sectors. So this really calls for more interdisciplinary research into how to address different shortages in different sectors. I think Purdue University is in a really great position to do this. We have a strong business school, engineering school, social science. I think this is a really good time that we all work together, faculty members and students work together to develop more solutions to help address all these different resource shortages in the healthcare sectors. Even though the nursing shortage is not going to disappear in the short term, I think we should remain optimistic. First of all, on the more macro level, I think many states, government have realized the issue. They have been putting more funding to increase the enrollment in nursing school, incentivize more people to join this career. On the other hand, this is where analytics like the data operations tool we developed is going to make a big impact. What we do is using analytics, mathematical modeling, and artificial intelligence to help utilize existing nurses more efficiently. So with the same amount of number of nurses, we can use AI to forecast what the hospital need them, so we can actually place them into the hospital or units that needed the nurses the most. So in a way, we can do more out of the existing nurse. So I think we should remain optimistic.